Okay, for my plan of action, I did it on air polishing. Air polishing is used to remove plaque biofilm as well as extrinsic stains. Air polishing is used with compressed air, water, glycine powder, or sodium bicarbonate, which depends on whether you are going subgingivally or supragingivally. Many offices and even schools, like at our school, for instance, we do have at least one air polishing unit. And as most dental professionals should know, plaque biofilm is the primary cause to gingival diseases such as gingivitis, which can later lead to more serious problems such as periodontitis. With the air polishing device, you're able to effectively remove that plaque biofilm. You can also clean the pits and fissures much easier prior to placing a sealant, which is great. And it's easier to clean those pits and fissures with the air polishing device than it is with a traditional polishing device. Air polishing can also be very beneficial to both the clinician as well as the patient. Now, for the clinician, it is very beneficial because it causes less fatigue and a more efficient treatment. And for the patient, it's more beneficial because they are not at the appointment for as long of a time frame, and also it reduces their discomfort. So the patient is more comfortable, which is always a great plus. Air polishing in the past has only been able to be used supragingivally, but recently it has also been able to be used subgingivally, even in like periodontal pockets, which is great to be able to remove the biofilm in there. It also reduces tooth sensitivity, and the cleaning is much faster. So you would be able to, you're supposed air polishing versus traditional polishing. Air polishing appointments should only take around 30 minutes, whereas if you have the traditional polisher, you usually get about 45 minutes to an hour for each patient. So you'd be able to see 2 patients in the amount of time that you would usually see one. There are numerous different types of air polishing devices, and I only have 2 listed. So a basic airflow handheld air polishing device runs about $1,800, and an abrasion system that isn't completely handheld runs at about $4,000. And I know that these prices seem high for just one device, but they will pay for themselves rather quickly. Research shows that since more patients are being able to be seen in a day, that increases the income for the office, which allows the air polishing devices to typically pay themselves off in around 2 to 4 weeks. Now, after these are paid off, you are still able to see more patients in a day, which causes more income for the office. You could use that to buy more air polishing devices or really whatever. Update your equipment. That's my take on the air polishing.